How can I treat my eczema?
Treating eczema really depends on the kind of eczema you have, how severe it is, and where it is. But we can think of some general steps that we take to control this condition. And those can be considered almost like a pyramid. So we start with a strong foundation, and then we gradually move up. The other thing to know is that in eczema, we often have different stages of the skin inflammation. And when it's really active, we know we want to put it to sleep quickly. And so oftentimes we talk about how do we treat eczema quickly to rescue the skin from that flare. And then a second stage of the treatment would be how do I maintain that healthy skin in the long term? So if we come back to our foundation, the steps that we would usually start with would be to make sure that we're educating ourselves about how to maintain a healthy skin barrier with normal good bacteria and good yeast that help to protect us, and that we're avoiding things that can make eczema worse, things like irritation, things like allergens delivered through the skin. And after we've gone beyond those general principles, we talk about using creams that deliver medications through the skin. And this is especially relevant to eczema that is local in certain areas that are easily treated with a cream. And that can be a cream that delivers corticosteroids, or there are numerous other creams that contain other medications that can control that overactive branch of the immune system quickly and very well. After we've gone beyond, so oftentimes eczema can spread and can be very difficult to manage over the entire body surface with just creams. And we know that it's a condition that also can affect systematically our immune system. And so we often will change to a next step if the first two are not sufficient, to add something like phototherapy, which is a physical treatment using UV, a very narrow band of UV, to control the immune system in the skin through standing in a light box several times a week. And that's something that can be really helpful and is a very safe option for controlling eczema. When phototherapy is difficult to access or not helping, what we would normally do is then move on to medications that are taken, what we say, systemically, so either by mouth or through injections. And those medications can either be traditional medications, which are usually more accessible, and then the more targeted therapies, which are newer medications that are more designed to control just a specific branch of the immune system and have usually better safety and tolerability than the older traditional medications.